Welcome to RevitalizeMD podcast with me, your host, Dr. Debra Durst, and my co-host.
Hey guys, Faraday Goli, nurse practitioner here at RevitalizeMD. And today we have a fun podcast on
Hair thinning.
hair thinning.
Yeah, so
Why does it happen? What causes it?
yeah,
What can we do about it?
yeah, how common is it and what can we do about it? That's
Yeah.
the big thing. What are the treatments, traditional and maybe some other things that we may do? So again, we have a very active practice that does wellness and sexual wellness. That's our passion, but we do regenerative aesthetics. So approach anything that somebody might be experiencing from an aesthetic and beautifying standpoint, as far as aging, so hair changes is common. So how common is hair thinning and what are the usual causes? But
Yeah.
as far as incidence,
So for women, about 40% of women have thinning by the time of age 50.
50% of men have hair thinning. And so again, I think that the severity for men is definitely worse when they have it, and that's related to male pattern baldness. So if we get to all the different causes for hair thinning, we're looking at hormonal changes. So with women, 40% of women as they age and as they hit age 50 will start to get some thinning. And a lot of that is hormonal decline.
It is
And
also
so
stress
So that's another cause that can happen. Yeah.
or thyroid
And
issues.
yeah.
That's another big one for women.
Yeah, so if you're looking at increased cortisol, that's stress, thyroid, hormonal decline overall, like those sex hormone decline. And then for genetics, is it an androgenic type hair loss for men? Is it genetic? Did your dad have it? Did your grandfather have it? So, and it can be also genetic for women as well. And so that's definitely, environmental
Yes.
can cause it. So there can be toxins that you're exposed to. And so that's one of the common things. And then meds, medical issues, like you said, thyroid. And are you on medications that can cause hair thinning? Because that is not an uncommon thing either. Yeah. So,
Hats, right? Guys that wear ball caps constantly.
and too tight for sure can cause an issue. So,
For some women, even like the cornrows, where they're real tight and pulling on that hair follicle, we can
the
see
traction
thinning.
hair loss.
Yeah.
Yeah, absolutely. So those are all the different causes. It's just very common, and it's a multifactorial. So our approach to hair thinning is always also a multi approach because you have to have a multifaceted approach to hair thinning because there's lots of different causes. So you have to be able to address it. So from a hormonal optimization, is it the thyroid? Do we need to optimize the thyroid? Is it something that's happened over time because of other sex hormone decline? Progesterone can play a role in that. Testosterone typically is an anabolic and is going to stimulate hair growth unless if it is an androgenic type pattern. Yes, you can have side effects with testosterone that would be hair thinning potentially with the conversion to DHT or the stronger testosterone. So that can happen, and that's actually some of the treatments is blocking that conversion and blocking the activity of DHT or dihydrotestosterone. So definitely hormonal decline in optimizing, looking at whether that's a cause or not is one of the approaches that we would take. And so some of the other approaches that we take in the office on a regular basis is then starting to regenerate. So we're going to start regenerating, looking at the different things that we can do to get that hair follicle into an active phase and out of a resting phase.
Yep.
And so
And we can do that with lasers.
yes. Yeah, we have multiple different lasers. And you always hear about the laser, home therapy, red
The lights and stuff like that.
And so some will use that. We actually are taking that laser and focusing it on the scalp and creating microchannels that will stimulate that. And then also putting a topical on that has peptides in it and has growth factors in it. And so that is one of the ways
stimulate
that we'll do
that
it.
growth.
Yeah. Get that hair again into the active phase, out of the
shedding phase.
Yeah. And what's interesting about that is because it's not just increase in hair follicle number, but also in the thickness of the hair follicle, and also increase in the multiple, like you'll have different hair follicles coming, different hair coming out of each follicle. And so you'll get more than just one hair from each follicle. So that's another thing that increases is, and again, we don't do hair transplantation
We
at
don't,
the
but that is
office.
out there. But I think that is when we start talking about treatments and how aggressive we're going to go with treatments. I think that there are plenty of regenerative options out there that you don't need to go and have a surgical procedure.
Yes, no, I think that again, once your hair loss is really severe, if you're looking for a magical fix,
That would be
you're,
different.
you're probably going to have to look at surgical, because what we do from a regenerative standpoint is not going to give you a regrowth of your entire scalp. But when you have thinning and it is just starting, back at the head, and again, that male pattern baldness,
Right
as you
along
start
the
to recede
edges.
and it starts to go back and it's thinning, those are the times that you want to hit that and the crown of the head. And then women tend to have it in the same pattern, but just a lot more mild when it is a female pattern baldness. And so if you're thinking that it's hormones, you need to get your hormones checked for sure. If DHT tends to be an issue, it's not always that testosterone is too high, the conversion may be too high, but sometimes it's not even that the conversion is too high, but the DHT will basically concentrate in the hair follicle. And
Yes.
so a lot of that other ways that people treat, so like when they talk about minoxidil, which is
Or
a common drug,
finasteride.
finasteride, you're talking about giving things systemically or taking them orally that work on the hair follicle. So if it's an isolated hair follicle issue, why not consider
Just do it
topicals?
topical.
Yeah,
And then you're not having to take something systemic.
with potential side effects, insignificant side effects. And so alopecia being one of those, finasteride. So we have a lot of men that will come in with erection issues because they have taken finasteride or alopecia for hair loss because they're Googling. They can get that. They treat it at home. It's oral, it's not topical they're using, and you'll have erection issues related to DHT and blocking of DHT conversion because some men need that. So it isn't something you should just Google and treat yourself. You really need to have it looked at by somebody that specializes in looking at that whole picture and then addressing it the same way. And so we love doing that, looking at hormones, doing those regenerative treatments, injectable treatments. And so
And maybe changing up a little bit of those medications that you are using, pulling you off some, maybe adding something different, adding some supplements.
Yeah.
Because there are some supplements out there that are great at naturally blocking DHT or helping with hair regeneration.
Yeah. And so, a couple of them, even saw palmetto is one that you'll find in different products. But Nutrafol is one of the different products that we have that in the office, the number one hair supplement. And so everyone loves it when they take it, because if you're thinking about hair loss from a multifactorial etiology, then you need to look at it from a treatment on all the different levels.
Nutritional and hormonal.
Yeah, so that cell has to be healthy and have all the the nutrition it needs. So if you're addressing it with laser stimulation, and in addition, we're doing PRF injections.
Yeah, that's
to
what I was
the
going to
head.
say. That's our favorite. That's
Yeah.
one we haven't talked about is
No.
PRF, so platelet-rich fibrin. That's when we draw your blood, spin it down, take that those platelets, those concentration where all your growth factors are, and re-inject back into the scalp.
Yeah. And
A little
again,
bit more concentrated.
you'll hear PRP because that's the standard that has been used for so long, and PRP is first generation, PRF is second generation. We have done a previous video way back, that dates way back,
Yep.
to the difference between the two. But basically, PRF is processed differently so that you don't remove everything but the platelets. So you still have some red blood cells, you still have some growth factors in the PRF, and then you can re-inject it. You don't use any anticoagulant. So in simplicity, we inject that blood product with a concentration of platelets into an area to regrow, and the scalp is what we're talking about, the hair
And
follicle.
it keeps it more concentrated in the places where we inject.
Yeah, and then it actually forms a clot after injection, and so that fibrin matrix keeps the platelets in place, and then you have release of growth factors from those platelets over an extended period of time, 7 to 10 days, maybe even up to 3 weeks. And so it's just a second generation, more advanced form of PRP, but shows promise in hair loss.
Yeah.
So
So with hair regeneration, we don't use PRP anymore in practice. We I think pretty much only use PRF at this point, just
Yeah.
because we've seen so much, our results have been so much better with it.
Yeah. All PRF, the only place we still use PRP is for sexual wellness and O shots and P shots because,
Even
just
in
of
the
that.
face regenerative, we
Yeah.
use PRF for a lot of stuff. I mean,
All
I guess we still
PRF.
use some PRP,
Yeah, topically probably
topically more than anything else. But if
Yeah.
we're injecting, we're doing PRF.
Yeah, so we just are processing it different. We love PRF. We love the
It's a little bit
fact
more
that you,
advanced, better results.
the fact that you can get so much goodness out of just your blood, and so that you can concentrate platelets. And if you think about the arm, you cut yourself, platelets go to the area, they heal, and they stop the bleeding, but they also release growth factors, so you grow back skin. When you've had a cut, and that's how that happens. It's platelets and the magic of platelets, right? So that is one of the things. So we're talking about lasers, laser regeneration, getting the hair follicle active again, PRF, Nutrafol is hitting it from the nutrient standpoint, and so that
Lasers
and
with the
then
microchannels or microneedling.
yeah,
Either way to make those little channels.
and then you put the topical in so it seeps down into the hair follicle, and then comprehensively addressing the hormones too. One of the some at-home things that you can do, because the supplements are important. Nutrafol we love. It has
Yes.
all the ingredients you'd want. Biotin, and has marine type proprietary blend that will help
It
with
has saw palmetto to help with DHT blocking.
yeah, it has like all the things you want in one product, and it is the number one selling.
I believe it has
Again,
ashwagandha in it too, which helps healthy
Yes,
hormone
correct.
support.
Yeah,
So it's the best blend.
the best blend, and it is something that we sell at the office. We don't have a collaboration with them. We just sell their product because we love it
We believe
and
in
we
it.
believe in it. So that is a good one to get. We'll put a link in the description below. So it has everything that you want, but even scalp massages. And I say the world would be a better place with more scalp massages.
I think the world would be a better place with more massages in general.
Period, yes. And I never wanted to really say a head massage because then people would like comment and some off. But scalp
Yes.
massage, but that actually can stimulate potentially.
Well, think
And
about it
even
now. They have those whole boutiques around around hair washing now. Have you seen those?
No,
Have you not?
no.
Okay, so I have a 7th grader, and this is something that the kids, it's all over TikTok, and she brought
You
it to
go
me.
in and
But
they just
they wash your hair, and it's like a massage, and it uses very focused, pinpoint, little, like a shower head.
why do I not know about this?
I don't know, but it's intriguing.
Yeah, I got to find out about this.
So
'cause I
in our
think for
office,
the
we also
world-
do like a hydro scalp to
Yeah.
help remove all the buildup. So when my daughter was showing me this, it made me think, I wonder if this is something that can also help clean out those follicles. That would be good for our patients to
Yeah.
do. But yeah, everybody should get a scalp massage.
Everyone should, because the world would be a better place, and it's just very relaxing.
Yeah.
And a lot of head and neck pain is actually 80% of it is muscle, and so you're not talking about just like your usual muscle and trapezius and arm and neck and paraspinal, but you're talking about like your temporalis, your frontalis. Those muscles, occipitalis in the back.
Yeah.
Those are all muscles that, again, if we paralyzed with like a Botox, helps with head and neck pain. But if you have a scalp massage and you have a little pressure point and you have a release, that helps. And so these are things you can do at home, things that you can get your partner to do at home for you. And rosemary kind of helps with that. But yeah, we use Hydroscalp in the office because if you think about your face and all the stuff we put on our face, and we clean our face all the time, we do the hair, but we put as much in our hair as we do on our face.
Yeah.
And so we do a hydrofacial, which is a machine that sucks out all the dirt. So it's a machine that does a facial. And we're talking like we want things that work. I don't want somebody just to massage things into my face.
No, I want my
people to
blackheads sucked out,
Want
all the dirt out of my pores.
Yeah.
So it's the same machine, but we use it on the scalp to help clean those
Yeah,
follicles.
yeah, and so it's perfect for the scalp because it does do that.
You don't
Maybe
think the
they have a
dry
little massager after
shampoo?
that we need to look at,
So I think it does. I think it washes and massages. I think it's like your best of both worlds.
but it doesn't
It's like a
suck
head
the
spa.
dirt out. It just does the
Well,
cleaning
no,
on
but
the
it would clean
surface.
it and massage it.
But if we can have like a little massager after the suck out part, maybe
no,
can
maybe
do
we
that
need a
then.
head spa in our office.
Yeah, yeah. Oh, we definitely need that for sure. I need that. So, but anyhow, and I think that like the average household, that massage chairs, the average household is like on hair products, and this is just an isolated like on hair products, $500 to $1,000 a year on hair products.
see that.
And it's much higher than that if you're actually looking at focused products to try and get hair growth to happen. So, that's just if you're buying hair products and, hairsprays and shampoos and conditioners and all the styling gels. But then it's a much higher number when you're actually trying to get your hair to grow back. And so it's worth that trip into an office if it's something that's bothering you, because this is something we take out into the world every day. And so if something bothers you and you're thinking about it on a daily basis, it's probably time to at least get it looked at and see if you can get something that helps. So anyhow, it helps, again, that self-esteem and image, and there are things you can do, and it's a very common condition, and there are so many things you can do like we just talked about. So if it's bothering you, I think you should definitely seek out at least a consultation with somebody to see if you can get something that will help. So, and if you have any experience with any treatments for hair loss, or you
Or
have
products. Maybe you have a product you love that's been successful. Let us
Yeah.
know. We'd love to
Yeah.
hear about it.
And it's something that we haven't really done or recommended a lot at home because we have all the devices in. But if you have something in particular that you like from an LED, that you're using, I would love to hear about it. But let us know your comments, like, subscribe, do all the things, and then let us know if you want to talk about anything else, because we're willing to deep dive into anything wellness and sexual wellness. Thank you.